Hold on.
Okay, nearly everyone knows someone who smokes. And so today I will tell you about the different ingredients found in cigarettes, different diseases connected with smoking, and the effects of secondhand smoke, and also go over some of the ways to quit. And hopefully the smokers will consider stopping, and the non-smokers will not start. According to the last surveys, which was out of 18, it was split 50-50. There were 9 people who smoked and 9 people who didn't. Of those 9 that smoked, one person said they have smoked, they do not smoke anymore. 2 people said they smoke about a pack every 2 weeks, and 6 said not that much. So first, the ingredients found in cigarettes. Everyone has heard of at least one ingredient found in cigarettes, and most of it is nicotine. There are approximately 600 ingredients in cigarettes, and when burned, they create more than 4,000 chemicals. At least 50 of these chemicals are known to cause cancer, and many are poisonous. Here's a video or a commercial.
Today we will be dissecting the Ramona spinners. Learn more. Dissecting the Ramona spinners. You gonna drink that? Cigarettes contain formaldehyde, the stuff used to preserve dead frogs. Learn more at tobaccofreeflorida.com.
Okay. And also many of these chemicals are found in different products, but these products have warning labels on them. And so the warning labels say the dangers of these chemicals, but there's no warning labels for the toxins found in tobacco smoke. And here's a list of some of the chemicals and common things that they are found in. There's acetone found in nail polish remover, acetic acid in hair dye and vinegar, ammonia, which is a common cleaner, arsenic used in rat poison, benzene found in rubber cement, butane in lighter fluids, cadmium, which is in battery acid, carbon monoxide released in car exhaust, formaldehyde, hexamine found in barbecue lighter, lead used in batteries, and methanol, which is used in rocket fuel, and tar, which is a material for paving roads. And some of the health risks, most people think that smoking affects just the lungs, throat, and heart, but smoking harms nearly every organ of the body. Half of smokers who keep smoking will end up dying from a smoking-related illness. And in the United States alone, smoking is responsible for nearly 1 in 5 deaths, and about 8.6 million people suffer from smoking-related lung and heart diseases. Some of the common health problems associated with smoking are cancer, lung diseases, heart attacks, strokes, and blood vessel diseases. Nearly everyone knows everyone knows that smoking can cause lung cancer, but few realize that it is also linked to higher risk for many other kinds of cancers too, including cancer of the mouth, nose, sinuses, larynx, pharynx, esophagus, and some of the different ones you probably didn't know were bladder, kidney, pancreas, ovary, cervix, stomach, colon, and acute myeloid leukemia. Lung cancer is the leading cause of death, and cigarette smoking causes most cases. Men who smoke are about 23 times more likely to develop lung cancer, and women are 13 times more likely to develop lung cancer than non-smokers. And smoking greatly increases your risk of getting long-term lung disease like emphysema, chronic bronchitis, and these diseases make it harder to breathe and are grouped together under the name chronic obstructive pulmonary disease, or COPD. And COPD causes chronic illness and disability and gets worse over time, sometimes becoming fatal. And emphysema and chronic bronchitis can be found in people as young as 40, but are usually found later in life when the symptoms become much worse and they're too late to cure or treat. And long-term smokers have the highest risk of developing severe COPD. Pneumonia is also included in the list of diseases caused or made worse by smoking. Smokers are twice as likely to die from heart attacks than non-smokers, and smoking is a major risk factor for peripheral vascular disease, which is a narrowing of the blood vessels that carry blood to the leg and arm muscles. And smoking also affects the walls of the vessels that carry blood to the brain, which can cause strokes. Smoking can cause abdominal aortic aneurysm, in which the layered walls of the aorta weaken and separate, often causing sudden death. And smoking causes an increased risk of macular degeneration, one of the most common causes of blindness in older people. It promotes cataracts, which cloud the lens of the eye, and it also causes premature wrinkling of the skin, bad breath, gum disease, tooth loss, bad smelling clothes and hair, and yellow fingernails. Because smoking can cause many health issues, you can lose years of your life. Based on the data collected in the late 1990s, the U.S. Center for Disease Control and Prevention estimated that adult male smokers lost an average of 13.2 years of life, and female smokers lost 14.5 years of life because of smoking. Each year, smoking causes early deaths of about 443,000 people in the United States. And given the diseases that smoking can cause, it can steal your quality of life long before you die. Smoking-related illness can limit your activities by making it harder to breathe, get around, work, or play. Next, smoking just doesn't affect you. Secondhand smoke contains more than 7,000 chemicals, and hundreds are toxic, and about 70 can cause cancer. There is no risk-free level of exposure to secondhand smoke. Secondhand smoke causes numerous health problems in infants and children, including severe asthma attacks, respiratory infections, ear infections, and sudden infant death syndrome. Some of the health conditions caused by secondhand smoke in adults include heart disease and lung cancer. Secondhand smoke causes an estimated 46,000 premature deaths from heart disease each year in the United States among non-smokers. Non-smokers who are exposed to secondhand smoke at home or at work increase their risk of developing heart disease by 25 to 30%. Breathing secondhand smoke interferes with the normal functioning of the heart, blood, and vascular systems in ways that increase the risk of having a heart attack. Even brief secondhand smoke exposure can damage the lining of blood vessels and cause your blood platelets to become stickier, and these changes can cause a deadly heart attack. Non-smokers who are exposed to secondhand smoke at home or work increase the risk of developing lung cancer by 20 to 30%. And some of the ways to quit smoking is just quit and never start again. Or you could gradually decrease the number of cigarettes you smoke. And you can use nicotine replacement therapy or nicotine medications to reduce withdrawal symptoms. There are nicotine support groups, and trying hypnosis, acupuncture, or counseling using cognitive behavioral techniques. So after listening to this, I hope that the smokers will consider stop smoking and the non-smokers will not start.